Today's topic, breast or mammary gland. So the mammary gland is a modified sweat gland present in the superficial fascia of the pectoral region. So what's the meaning of the word fascia? So a fascia is a band or sheet of connective tissue that is located beneath the skin that attaches, stabilizes, encloses and separates muscles and other internal organs. So fascia is classified by layer as superficial fascia and deep fascia and parietal or visceral fascia. So the mammary gland is found in both sexes, male and female. However, it remains very basic in male but becomes well developed in female at puberty. So on rare occasions, the breasts of male become enlarged. This condition is known as gynecomastia. Here you can see the breast of male become enlarged. So this condition is known as gynecomastia. So in female, it forms an accessory sex organ of female reproductive system and it provides milk to the newborn baby. So the anatomy of breast is of great surgical importance and therefore needs to be studied in detail. The breast is located in the superficial fascia of the pectoralis region. So this one is the superficial fascia of the pectoralis region. This one is the green color line is the deep fascia, or it is known as pectoralis fascia because this pectoralis fascia is located above the or anterior to the pectoralis major muscle. A small extension from the superior lateral part pierces the deep fascia and extend into the axilla. Here you can see the superior lateral. So this is the superior one, this is the lateral. So the superior lateral part, it is known as axillary tail of Spence. It pierces the deep fascia, this green line. So this axillary tail of Spence pierces the deep fascia and extend into the axilla. You can see the axillary tail of Spence extends into the axilla. So the opening in the deep fascia through which axillary tail of Spence passes into the axilla is called foramina flanger, this one. So here you can see this one, foramina flanger. So the foramina flanger is the opening or a hole in the deep fascia through which axillary tail of Spence passes into the axilla. So this axillary tail of Spence is the site of high percentage of breast tumor. So the breast is hemispherical bulge. This is the hemispherical in bulge. So vertically, so this is vertical, horizontal. So vertically it extends, the breast extends from the second rib to the sixth rib. So horizontally it extends from lateral border of the sternum to the mid axillary line. This is the mid axilla, located axilla, so mid axillary line. So vertically it extends from second rib to the sixth rib and horizontally extends from the lateral border of the sternum to mid axillary line. So the deep aspect of breast is related to pectoralis fascia, that is the deep fascia, and three muscles: pectoralis major muscle, serratus anterior muscle and external oblique muscle. And you can see this one is the pectoralis muscle, the chest muscle, serratus anterior muscle, that is above the ribs, rib bone, and external oblique muscle, the abdomen muscle. So the pectoralis fascia, that is the deep fascia that covers the anterior part of the pectoralis. This is the pectoralis major muscle. So the breast is the breast is separated from the pectoralis fascia by a space. which is filled with loose areolar tissue. It is known as retromammary space. Again, the breast is separated from the pectoralis fascia, that is the deep fascia, by a space. This is the space which is filled with loose areolar tissue. This space is known as retromammary space. So due to the presence of loose areolar tissue in the retromammary space, which is located deep to the breast can be moved freely up and down and from side to side over the pectoral fascia. So the breast consists of skin, stroma, parenchyma or glandular tissue or mammary gland proper. So the skin is the covering for the breast and it presents nipple and areola. So nipple is the conical projection below the center of the breast. It is usually located at the level of 4th intercostal space. As you can see, the nipple is located at the level of 4th intercostal space. So this nipple contains smooth muscle fibers. These smooth muscle fibers can make the nipple stiff and erect or flatten it. So being richly innervated by sensory nerve endings, the nipple is the most sensitive part of the breast to tactile stimulation and become erect during sexual arousal. So next, areola. So this areola is the circular area of pigmented skin surrounding the base of the nipple. So it contains large number of modified sebaceous glands, particularly at the outer margin. So this areola produce oily secretion which lubricates the nipple and the areola and thus prevents them from drying and cracking. So the color of the areola, as you can see, the color of the areola and nipple varies with the complexion of the woman. So if the woman is black, the areola and nipple might become black, and if it will do the same for the white woman, or it will do the opposite. So during pregnancy, the areola became darker and enlarged. So the sebaceous glands in the areola are enlarged during pregnancy and appear as small nodular, here you can see, appears as small nodular elevation. This is known as Montgomery tubercle, M-O-N-T-G-O-M-E-R-Y, Montgomery's tubercles. So the stroma of breast, this is the stroma of the breast, consists of connective tissue and fat. So the stroma forms the supporting framework of the breast. The stroma forms the supporting framework of the breast. The connective tissue condenses to form fibrous strands or septa known as suspensory ligaments of Cooper. So these suspensory ligaments of Cooper are arranged in a radial fashion. So they connect the dermis of the overlying skin to the duct of the breast and pectoralis fascia. Again, the suspensory ligaments, this is the suspensory ligament of Cooper, are arranged in a radial fashion. They connect the dermis of the skin to the ducts of the breast and pectoralis fascia. So the ligaments of Cooper maintain the protuberance of the breast. Protuberance, this is the protuberance of the breast. So the ligaments of Cooper maintain the protuberance of the breast. So due to aging, the breast became pendulous. like this. So pendulous breast due to aging. The fat forms the most of the bulk of the breast. So the fat distributed all over the breast except beneath the areola and the nipple. The fat forms most of the bulk of the breast. It is distributed all over the breast except beneath the areola and the nipple. So the parenchyma or glandular tissue of the breast secrete milk to feed the newborn baby. So you can see the parenchyma or glandular tissue of the breast secrete milk to feed the newborn baby. So the parenchyma consists of about 15 to 20 lobes arranged in a radial fashion, same like the ligaments of Cooper, arranged in a radial fashion. So this resembles this parenchyma glandular resembles the spokes of a wheel. The wheel spokes looked like this. So this parenchyma glandular tissue arranged in a radial fashion that resembles like the spokes of a wheel, and it converges towards the nipple. So the each lobe is divided into lobules. Here you can see each lobe is divided into lobules. So these lobules contains the cluster of axini. Again the lobes is divided, each lobe is divided into lobules. Here you can see each lobe is divided into lobules. This lobules contains the cluster of acini. So each lobe is drained by a lactiferous duct. So the lobe is drained by lactiferous duct. So the ducts from different lobes converge towards the nipple and opens at its summit. So near the termination, each duct expands into a lactiferous sinus. This lactiferous sinus serves as a reservoir of milk during lactation. Again I explain, the parenchyma or glandular tissue of the breast secrete milk to feed the newborn baby. So this parenchyma or glandular tissue consists of about 15 to 20 lobes arranged in a radial fashion like the spokes of a wheel, and it converges towards the nipple. So each lobe is divided into lobules. Each lobe is divided into lobules. So these lobules contains cluster of acini. So each lobe is drained by lactiferous duct. So the ducts from different lobes, the lactiferous ducts from different lobes converge towards the nipple and open at its summit. So near the termination, each duct expand into lactiferous sinus. So this lactiferous sinus serves as the reservoir of milk during lactation. So next let's discuss about the arterial supply of the breast. So the breast is highly vascular. It is supplied by internal thoracic artery, axillary artery, or posterior intercostal artery. So the internal thoracic, the mnemonic to remember is MAP. So the internal thoracic artery is also known as mammary artery. MAMMARY, mammary artery. So mammary artery or internal thoracic artery, axillary artery, posterior intercostal arteries. As you can see, the internal thoracic artery through its perforating branches, which pierces the second, third and fourth intercostal spaces. And next, axillary artery. The axillary artery through its lateral thoracic, superior thoracic and acromiothoracic branches. Here you can see lateral thoracic, acromiothoracic and superior thoracic artery. They supplies the breast. Next is the posterior intercostal arteries. The posterior intercostal arteries through the lateral branches. Again, the arterial supply of the breast has a mnemonic MAP, internal thoracic artery, or it is also known as mammary artery, axillary artery and posterior intercostal arteries. This internal thoracic artery through its perforating branches, which pierces the second, third and fourth intercostal spaces. Axillary artery through its lateral thoracic artery, acromiothoracic artery and superior thoracic artery, and posterior intercostal arteries through its lateral branches. So next, let's discuss about the venous drainage. So the venous drainage of the breast take place by same like the arteries: axillary vein, internal thoracic vein, posterior intercostal vein. Again, the venous drainage of breast take place by same like the arteries: axillary vein, internal thoracic vein and posterior intercostal veins. The veins follows the arteries. So the nerve supply of the breast. The nerve supply of the breast is primarily somatosensory. So it is derived from second to sixth intercostal nerves through their anterior cutaneous branches and lateral cutaneous branches. Here you can see the nerve supply of the breast is primarily somatosensory. The nerve supply is derived from second to sixth intercostal nerves through their anterior and lateral cutaneous branches. So these nerves provide sensory innervation to the skin and carry autonomic fibers to the smooth muscle and blood vessels of the breast. So the sensory nerve ending in nipple, and areola plays the important role in stimulating the release of milk from mammary gland in response to suckling by the infant. So the secretion of the milk from breast is not under neural control but by prolactin hormone secreted by the pituitary gland. Again, the secretion of milk from breast is not under neural control but by a hormone known as prolactin. This hormone is secreted by pituitary gland. So the lymph from the breast is drained into a group of lymph nodes, axillary lymph nodes. Here you can see group of axillary lymph nodes and internal mammary lymph nodes and supraclavicular nodes. Here you can see supraclavicular nodes and posterior intercostal nodes and cephalic nodes lying in the deltopectoral group, the backside deltopectoral near the shoulder. So this axillary lymph node lying in the axilla is divided into four groups: anterior, anterior or pectoral, posterior and central and lateral groups. Again, these axillary lymph nodes which is lying in the axilla divided into four groups: anterior, posterior, central and lateral. So the internal mammary lymph nodes lies along the internal thoracic vessels. The supraclavicular lymph nodes near the clavicle bone lies above the clavicle. This posterior intercostal nerves lies in the posterior part of intercostal space in front of the heads of the ribs. These cephalic nodes or delta pectoral nodes lies in the delta pectoral groove. In addition to the above mentioned nodes, the lymph from breast also drains into subdiaphragmatic and subperitoneal lymph plexus. Thank you.